Hello, friends and families. Welcome to the EDUCA DPS Podcast. My name is Will Jones. I'm Executive Director of Communications for Denver Public Schools. Our guest today is Amanda Wentz. She is the Manager of Substance Use Prevention and Therapeutic Service Providers for our school district. Amanda, thank you so much for coming in today. How are you?
I'm great. Thanks for asking. How are you doing?
I'm really good. I'm really excited because the information that you hold is something that our families and community members need to know. So one of the first questions I have for you is just about yourself. You know, I know that you've shared with me that you're really passionate about this work. Can you tell us a little bit about yourself and where did that passion come from and how did you end up bringing it to DPS?
Absolutely. So as you already said, I'm Amanda Wentz and I manage our substance use prevention and therapeutic service provider programs in DPS. Long title, a lot going on there, but basically when we offer in-house therapeutic supports to students who aren't accessing those services through special education, or just everyone really needs substance use prevention, and when our kiddos are struggling a little bit with substance misuse, I also oversee those supports. I've been in human services in some capacity since I was 19. I just got rolling.
2 years. 2 years.
Yes, that's correct. I got rolling and never really looked back.
That is awesome. You know, one of the things that I was thinking about getting ready for this talk with you is that a lot of times people will hear the words therapeutic and substance use supports and they immediately start thinking about treatment centers. Mm-hmm. They immediately start thinking about hospitals. But we're offering these services in our schools. Mm-hmm. So I know there's some people out there who may be thinking, why should these supports be taking place in our schools and what does any of this have to do with education?
Absolutely. That's a really important point to clarify, I think, for folks who would associate that with an outpatient clinic, a hospital, a treatment center. Research shows us that access is really important. So when students need therapy, when they need substance misuse supports, we have a lot of studies that back up the fact that if it's accessible in their school, they're going to go and they're going to start treatment and they're going to finish treatment way more frequently than if they have to access those services in the community at large, which makes a lot of sense when you think about transportation barriers, cost, right? None of the services that we offer cost anything to families, and we don't really even interface with insurance systems. So access is huge. And then in terms of what does it have to do with learning, it's all about that hierarchy of needs, right? If we can't meet our basic needs around physiological regulation, I feel like I can breathe, I'm good, I'm ready to meet the day, I have what I need and I feel safe and supported, we aren't going to learn. And that's also something that's really quantified in research. Substance misuse supports, mental health supports, and often those are in the same bucket, right? Because a lot of our students struggle with substance misuse because they're self-medicating for mental health concerns. When we treat those issues, it's shown time and time again that students are able to achieve their potential at much higher rates.
When you're dealing with students, I know, like you, I was 19 2 years ago. And 3 years ago when I was in high school, there weren't always people who would be supportive if I had an issue. Mm-hmm. What do you see in the schools when there's a young person who's dealing with this, who's in crisis? Are their friends supportive or are their friends lashing out at them?
I think that their friends are as supportive as they can be, but something we say to students pretty often is it's really important when you're worried about someone you care about to access a supportive adult, because ultimately it's not their job and it's not great for their mental health to take that on 100%. So we want to have a network of those supportive adults who know how to respond in the schools. We know that traditional discipline, exclusionary discipline in particular, it disproportionately affects our students of color, our students who qualify for free or reduced lunch, and it doesn't work. Right. What they need is support and education, and to talk through, like we've already touched on a little bit, what brings them to the place where they are engaging in these behaviors that we would deem to be risky or problematic, right? Because those have been adaptive for them at some point.
Well, the work that you and your team do is another reason that I'm so proud to be part of Denver Public Schools, that we're offering this. And I know this work is helping to provide safe learning environments for our students. So how many of our students do you and your team support, and what kind of outcomes are you seeing?
That's a great question as well. Some of our programming, the substance misuse prevention component specifically has been around since 2015, and since 2017 we've been serving over 10,000 students annually. And that's with prevention education, fact-based information about what substances can create for you in terms of longer-term physiological impact. And then those therapeutic services we have started piloting as of last school year, and within that time we saw over 200 students for individual therapy, and overall our more one-on-one or small group interventions, about 500 students were served last year. We are across 36 schools in the district, ranging from ECE to our Pathways network. And
ECE?
yeah, we don't talk about substances explicitly, right? But even little kiddos have feelings.
ECE? That's what age?
That's 3, 4,
3
sometimes 5.
and 4-year-olds are dealing with this as well?
Well, you know, that's a great question too. Sometimes, yeah, the pandemic was really stressful, and they can't necessarily put it into words, and it's certainly not a diagnosis. But the earlier we get at these issues, the better the outcomes are, because the more that people know how to name their feelings, how to seek support when they need it, what the consequences of certain decisions are, the more that they're empowered to make decisions that really are best for them. Supportive adults, care, knowing what you're feeling when, these are things that I'd say that's applicable to 0 to 110. It helps us all, no matter where we're at.
Wow, it breaks my heart to hear that, but I'm so excited that you all are there to provide these supports. Amanda, as your team continues to work on creating a culture where educators, regardless of who they are in the building, can identify those warning signs. How do you all identify a student who may need some help, and what supports do you offer?
I can let that out.
And do you characterize it as a student in crisis?
So we have traditional psychologists and social workers. Everyone on our team is a school psychologist, social worker, or counselor. And we also have those folks in schools in much larger numbers than the small team that I oversee. Those folks are responding to a lot of the needs you're naming, and they're keeping an eye on kiddos, but sometimes they don't have the capacity to push in and offer these more specialized supports. So what we do is we push in with them. We are part of the mental health team. We see who they have seen struggling, but hey, I'm servicing these needs, but this component, the family, there's some substance misuse, there's some trauma. We need more, and then we push it and do that. But we also are all about equity in DPS, and we want to put our money where our mouth is. So DPS is one of the first larger districts in the country to roll out universal social emotional screening. So the best behavioral emotional screening system. You might have heard of it. It's a big deal.
Yes.
We have all of our kiddos, again, ECE on. We have parents report for those young kiddos, because sometimes how they're feeling is about how lunch went, right? But we get information on all of them, so no matter how they're showing up, we know if they might be at risk. Because what we know is some kiddos with anxiety or depression, they're not going to put that out there in the same way as kiddos with elevated anger or aggression. And we want to make sure that everyone has that equitable access. So we take the expertise of the folks that we have in buildings, of parents, of kids who refer themselves, and we supplement it with that universal screening data.
Now, you talk about wanting to make sure that all of our students have equitable access. We've got around 90,000 kids.
Yeah.
Those 90,000 kids aren't in 36 schools.
That's right.
So if I am one of those young people who needs some assistance, if I'm a family member who has a child that is at a school that needs some assistance, but they're not in one of those 36 schools, am I just out of luck? Or what does DPS have for them? Does DPS have something for them?
Yeah, DPS does have something for them. First of all, though, I would say that we should be in all 207 schools in the district. And so any points that folks have where they can advocate among the legislature, among nonprofits and funders in the community, let them know that we want to be further expanded in the district than we are, because we know that, again, that integrated care where you go to school is so important. But that said, obviously we want to make sure everybody's doing all right. So there are resources like iMatter Colorado is a really common one that was funded as a result of the elevated mental health needs among our students from the pandemic in Colorado across the state. So through that, they can access 6 sessions of virtual therapy at no cost to them. There's Denver Health is a great partner, right? Our school-based health clinics, people often don't realize, have therapeutic providers embedded who are employed by Denver Health and offer our students services, again, at no cost. In addition, the substance use prevention program that I oversee has a training project where we have folks on our team specifically dedicated to, they hotel at the central office, and if a school-based mental health team says, hey, we actually can support this and we're seeing really big need around substance use education or around anxiety, we can dispatch our training team and they can teach those folks how to deliver that intervention to the students. So that about doubles our impact in terms of the number of schools served in any given year.
Amanda, one of the best parts of my job is also one of the challenging parts of my job. Everything that goes on in the district comes across my desk, the good, the bad, warts and all.
Yes.
And over the last 7 years, there have been times when things have been so heavy that I've had to go talk to someone. But I had some people who say, well, you should be strong enough, Will. You should be able to push through. You shouldn't talk to a therapist. Are you crazy? If there is a young person out there who is watching this podcast, who is dealing with something, but is afraid that people will look down on them or think that they're weak because they're going to talk to someone, what message do you have for that person?
Oh, I would say that getting help is really, really strong. That's actually a sign of courage and strength. You're adaptive to tell somebody that you need that help. Maya Angelou said that the greatest agony is to carry an untold story inside of us. And if anybody knew, it was her. And that's what I have that quote framed in my office, actually, because I think that that is how we build community. That is how we normalize that these things do exist, is that we tell each other, and we show each other community care. In the West, right, it's a lot about what's wrong with you, what's your diagnosis, and sometimes it's about, I need community. And that doesn't actually necessarily need to be a therapist, but it needs to be, in a lot of cases, a trusted adult. And I gotta tell you, an industry secret, the best place to find a trusted adult is in a kid's home and in a kid's school.
That's beautiful and wonderful. And a great message for folks, because getting the help is strong. And don't be afraid to go get the help that you need, because we have the services here in Denver Public Schools. Amanda, I know that you probably, like me, have seen all the reports about fentanyl overdoses that are going on across the country. Are we seeing that here in DPS? And if so, how is your team addressing it?
We do know that some of our students in DPS have been impacted by fentanyl overdoses, if not directly, friends, loved ones experiencing that. And so we are a leader in the state, and I would say the country, in terms of enacting preventative care. In November, we had our first fentanyl education night as a program at East High School. Yep. And a community provider came. We had a community panel to kind of talk through the myths and realities of fentanyl, and then we also had a community partner distribute Narcan to parents who want it. Narcan, for those who don't know, is a medication that can be administered by a layperson that reverses the effects of an opioid overdose. So if somebody is overdosing, it literally saves lives. If they are not, there's not really a substantial, lasting negative impact, right? So it's a win-win to have it. So not only do we have these events, because there's 2 more coming up at DSISD and JFK in the coming months of these fentanyl awareness nights and education nights, but we're also we have, through nursing services, bless them, it's been great, all of our schools throughout the district. Again, K through 12, because you never know who's talking to you at any given point, right? We have adults in those spaces, we have adolescents in those spaces. They all have Narcan on stock. And they're all trained how to use it.
Wow. And so that people out there hear this from someone who is qualified and knowledgeable, I won't say it, but I'll ask you to say it. Because one of the things I've heard is that one of the dangers with fentanyl is anybody can make it. And sometimes people will make a fentanyl dose that you take it and nothing happens. And sometimes you will take a fentanyl dose and it will kill you because there's no regulation because people are making it in their bathtub. Is that true, or is that just a vicious rumor that I was told?
So there's definitely some truth to that. Fentanyl can be used in the medical community in a prescribed and regulated way. That's not what's out on the streets. And the difficulty with fentanyl is, like you said, it can be a grain of sand, and it's highly powerful. So just 2 to 3 of those can have a fatal impact. So sometimes people who are manufacturing or distributing drugs, they don't even intend to cut that into whatever they're putting out there. It's just, if it's even close, so little can cause such great harm. And so it really is a risk that we haven't seen prior to the uprise in fentanyl being cut into drugs over the past 5 to 10 years.
Wow, there's so many challenges our young people are facing in this gauntlet, just trying to make it to adulthood.
Absolutely.
I know another thing that I wanted to ask you about is vaping, because it seems like more and more young people are using vapes or vape pens, for tobacco ingestion. And what advice do you have for families? If you see your kid vaping, or if you know that your child is vaping?
Yeah, well, I mean, again, prevention is the best intervention when we're able to do it, which isn't always the case, but earlier discussions with your kiddos in developmentally appropriate ways around the risks associated with using tobacco long term are really important. And it doesn't have to be a scare factor kind of thing. You just can be objective and fact-based and really open up a dialogue, because that's another protective factor, right? Talking with each other. There's also My Life, My Quit, which is a free confidential quit line in Colorado. The Truth Initiative offers tools. Basically, if you need help with resources for your student to stop vaping, reach out to the Substance Use Prevention Program and we'll connect you with community resources. If you want to be involved in helping your student feel like they can have those conversations with you, start them up.
Amanda, could you build on that? And we're almost done. I don't want to set the record for the longest EDUCA DPS podcast, but this is so important, and you're so knowledgeable, and I want to make sure that this information gets out to as many people as possible. But what can parents do, building on what you were just saying, what can parents and trusted adults do to help prevent this from happening? I mean, you talk about the dialogue. Is that the main thing? Just talking with your kids, giving them a safe space to share their concerns so that they don't end up in these tough situations?
Yeah, absolutely. I think conversations and students there's just so much research that shows even if a kiddo has one trusted supportive adult in their life, that is going to protect them from significant negative health outcomes in the future. It's really wild how much 1 to 3 people can mean in a kiddo's life. And so it's opening up those dialogues. It's making sure they have access to supportive adults, because we can't, again, community is important. We aren't islands as parents, and it does take a village. So coaches, teachers, there's just there are paras and special education programming. There are so many adults who can wrap around and show that student that they care about them and that kiddo matters. Also just tapping into student interests, right? We know that positive feedback has a much greater impact than criticism, even though I have 2 kids and I know it's hard sometimes.
Yeah.
So really offering that positive feedback, noticing our kids' strengths and interests and engaging them about that too, because DPS programming, our substance misuse programming, our mental health programming is top notch. So is a lot of our extracurricular and sports programming, right? So plugging into something like drama or football really helps keep kiddos engaged in a way that doesn't impair their health outcomes. So being mindful of that, teaching them coping skills is another one, right? I think that we all feel when somebody says, well, just take a deep breath. It's like, okay.
Right.
But for younger kids, truly, you can model breathing, right? Deep breathing. You can model gratitude. And there are these protective factors in terms of how they cope with stress that you can imbue them with. And we see more and more. I know we see a lot more challenges facing our kids. We also see them saying, okay, I'm going to take a minute and do some breathing before I respond to that. I mean, the the maturity with which they show up to this stuff is something I didn't see growing up. And so it makes me very hopeful, and that's from our teaching, right?
Mm-hmm. You know, Amanda, one of the things I didn't hear growing up was substance misuse. Mm-hmm. And I'd noticed that you're very intentional to say substance misuse. Back in the day, it was substance abuse. Mm-hmm. Why the specific choice of words to say misuse as opposed to abuse?
Because you're not using it for its intended purpose, so it's a misuse, right? But abuse as a word carries some connotations. It's very similar to how we've moved from saying committed suicide to died by suicide. These things aren't crimes. These things are coping mechanisms that people utilize that largely have the most negative impact on themselves. It's adaptation to outlandish circumstances around them, right? So we don't want to say, oh, look at you, it's a moral failing. We want to say, hey, that's not what it's intended for. Right. It's not probably going to be healthy for you, but no judgment. What do you need? Because normally when we're seeing you show up in these ways, there's an unmet need behind that behavior.
Wow. I'm so happy to have this time with you. I'm going to let you go, but I did want to ask you, where do we go from here? I mean, we have this amazing program in place. What's the future look like?
Oh, that's a great question too. We want to grow. I'm really ambitious. I really am very passionate about this stuff and have been since a very young age. I grew up in Wyoming. There just wasn't a lot of this, and that I saw lives lost as a result of that. And so what we need more. And what is in my locus of control is to continue educating and growing my team. So something I'm really excited about over the next couple of years is we are getting our entire team trained in a very highly evidence-based intensive trauma therapy modality so that our kiddos with post-traumatic stress, which we know has so much to do with mental health and substance misuse, they can access evidence-based care that normally would be $200-300 a session. It's free and it's at school, and we're working with the Center for Policy Research to conduct the first wide-scale study of this intervention in schools. I mean, it's big stuff. So I want to grow and I want to keep pushing so that all of our students, like you said, it shouldn't just be these 36 schools. It should be across the board. Our students have access to this care, and that's why I'm here.
Well, perfect. Well, we're so glad that you are here. This is so important because my hope is that none of our families ever have to become advocates after they've dealt with a crisis like this, and that you all are on the front lines. To let you go, I'll sit back, give the floor to you. Is there anything else you'd like to say to our families?
Just reach out if you need help. Just like we're saying for kiddos, sometimes it can be really overwhelming as a parent or even an educator to know what to do. We don't take classes about this outside of the mental health and substance misuse disciplines, but there is help. A lot of folks, even some people in the district, don't know we exist. We're here and we want to support, and we have a training team ready to dispatch. They are answering emails and phone calls. If you want some support for your mental health team to deliver to your students, if you're a parent and you don't know where to stop or start, call us. That's the long and short of it. This works in a way that traditional discipline doesn't. Punitive measures don't work, right? We want to cut off that school to prison pipeline. We want to meet people with mercy and humanity. And so if you want some guidance in knowing how to do that, that makes a lot of sense. And I would just ask that you reach out.
Amanda Wentz, thank you so much. Thank you for everything that you do and that your team does. You're saving lives. You're changing lives. And also thank you for all this valuable information. I hope that you all will utilize this information, make the phone calls, reach out to your schools, reach out to your school leaders, reach out to your children, because again, we don't want you to end up being an advocate for this after you've had to go down a dark, dark path. Well, friends and families, this concludes this edition of the EDUCA DPS podcast. Please help us share this content. I know that you like this. I know that you enjoyed it. I know that you are going to use this information, but don't keep it to yourself. Make sure other families have that information. Share it with your friends. Let the community know about the services that we have here at DPS to help make sure that our kids help make better choices when it comes to this very important topic. My name is Will Jones. See you next time.